Hello again, everybody. Welcome to yet another edition of Journey Through Sports and Life. Delighted to have you here as we come to you not from the great state of Texas today, but we come to you from Louisiana. That's right. We're just down the street from something called the French Quarter. Ever been there, ladies? Yes.
A few times.
Yes, I'm sure. But of course, this year and this week, it's all about Super Bowl 59. Philadelphia Eagles taking on the two-time reigning defending champion Kansas City Chiefs, looking to become the first team in 59 years to win 3 Super Bowls in a row. Wouldn't that be something, huh?
That would be.
A
never,
part of history.
Never happened.
But we're here at Media Row, where we've got radio and television stations from all over the country gathered here and just talking about all the hype that's going to be taking place throughout this week into Sunday's big game coming up Sunday afternoon. That's when the kickoff's set to take place. I'm Scott Murray along with
Marjorie Lewis.
Marnie Schneider.
And I tell you what, why don't you take it away, my friend, and introduce to you our special guest.
Yes, we have a guest today, Dr. John Hinson. He's remote, so we have him visiting us from I guess you're in Florida?
Yes, ma'am. At the moment, Palm Beach Gardens.
Yeah, okay, great.
At the moment,
nice
he
place to
flies
be.
all
I know,
over
so
the
I'm
world,
sure it's
right?
hard to know where he is, so I had to ask again. But we invited Dr. Hinson to join us because he's an orthopedic surgeon. And of course, that's part of the topic. That's part of the discussion of what's going on now in professional sports and in particular football. We're here at the Super Bowl, so we'd like to talk a little bit about the things that happen, rehabbing some of the athletes or how they recover from injuries, what Dr. Hinson does to help college and maybe former professional athletes on their road to recovery. Dr. Hinson, just briefly, is a board certified in orthopedic surgery. He has been since 2012. He specializes in traumatic and degenerative conditions of the shoulder and elbow, including arthroscopic surgery, rotator cuff surgery, instability procedures, and replacements. And he'll tell us a little bit more about that. But thank you for joining us. Welcome to Journey Through Sports and Life.
Thank you. I appreciate you guys having me on.
So tell us, what are some of the most common injuries that you see that you have to deal with current athletes and former athletes, especially in football?
Absolutely. In football, being the primary contact sport that we see in our country, there's a group of injuries that are going to be more common. Specifically, in my subspecialty, shoulder injuries, including dislocations, are reasonably common. And we see kind of 2 dislocations in the shoulder. One, when we dislocate the ball and socket, what we would label as a shoulder dislocation, fairly common, particularly in the skill players, linebackers, receivers, guys that are getting hit or delivering hits and can dislocate their shoulder. And then the other thing that's relatively common is shoulder separations, where they will separate that small joint between the end of your collarbone and shoulder blade. Also a reasonably common injury. Here, just in my local population of athletes, saw several of those this season. And fortunately, a lot of times we're able to get these guys back out on the field reasonably quickly. This time of year and for this football game, obviously the focus is getting these guys back on the field within reason. If you can do it with some safety, they're going to make every effort to get these guys all stops off or pulling out all the stops to get them on the field. It's the Super Bowl, So.
Oh yeah, and when you reach the Super Bowl, you know that you have been a football player for a long time. You've probably played in high school, college, and beyond. But what about playing a different number of sports early on rather than focusing on just one? Does that help reduce some of the injury prone, anything like that?
I think there is some advantage to that. The group that's probably most help is our throwers, because the problem we see in South Florida is an absolute hotbed of this, because we have the climate. These guys can throw baseball all year long, and unfortunately, that's what they do. They'll, by 6, 7, 8 years old, are playing baseball 365 days a year almost, and there is a big advantage to taking some time off, and it can be as simply as playing another sport. And unfortunately, it's a bit of a bygone era where guys would play football in the fall, basketball, and then baseball, and that cross training was hugely protective. And there's some similarities to footballs down here. I mean, they play fall and spring football, even down to midget or whatever you want to label the junior football players. There's contact football down here. They're playing 2 seasons a year, and it does. You can imagine the accumulation of head injuries and blows to the head and stuff
Oh
that
yeah,
occurs
definitely.
over all those years, and our growing, wealth of knowledge about CTE and head trauma. That's a concern, and you see the rise of the flag football leagues down here, and I understand why, and I will deal with parents who are like, I'm not letting my son play football. And I as a parent with one son and a couple dollars, I understand a parent's position. So speaking directly to your question, I think that cross training and doing these other sports is a nice thing. It is tough as a parent who's had kids go. Two of my kids played recreational athletics growing up. You feel left behind when you see the kid that's doing that sport 12 months a year. You feel like you're getting behind, and there's a lot of peer pressure to be allowing your child to do that.
Hmm.
But particularly what I'm telling a parent at 8 and 10 years old, yes, get the reps in, but don't let yourself get too pressured for 8, 10-year-old, whether it's football, baseball, whatever that sport
Yeah.
is, and allow them to do some other stuff. Allow them to feel out, see what they enjoy, and they can put the time and effort into it. But there's definitely a role to get the other things in. So.
Hmm. Okay. Well, I have a habit of asking a lot of questions, so I'll pass this along to Marnie and Scott next.
Well, so are there things that you can do to? What would you tell somebody that? Uh, how do they prevent themselves, just as a regular civilian, from maybe injuring themselves? Just if you're going to go exercise or whatever, what are some of the common things that you see as a professional, or that we do as amateurs, not professional athletes with
Absolutely.
trainers?
Absolutely. And as a person who is kind of aging into this group, this question is going to be geared for. The reality is the meat of what I see in my clinic daily is going to be recreational and sometimes serious recreational athletes that are 40 plus and mostly 50 plus year olds. All right. And so this is definitely not necessarily an answer meant for my 25-year-old athletes, but as you are getting to that middle point in life and wanting to continue to be active and be strong and do exercises, including resistance stuff, there's things you can do to improve your safety. And so some of it, if you have never had a shoulder problem, what I do a lot of, and then this also spills over into other joints, particularly lower extremity, where if you're doing any running activity or an upright activity, an aerobic exercise, maintaining strength, there is a need and an advantage to doing some resistance exercises. We have plenty of people whose passion and what they enjoy is purely just doing cardio, and they're particularly some who say, hey, look, I'm not interested in building muscle. I don't want to be bigger. I want to be lean. I want to be lean. I want to be thinner, and that's fine. But I will educate those people. There is an advantage to maintaining the strength and building the strength in your extremities, and specifically in the shoulder, where I'll tell people, look, there's just 5 or 10 minutes a day, or do it on the days you exercise, to build the strength in your rotator cuff, build the strength in your shoulders, and that can be absolutely protective. And then the other thing I'll point out to people, particularly as they age, is technique with these resistance exercises is really important. And so if you go to the gym and you go to the weight area and see people lifting weights, we've all seen that person who truly has too much weight, right? And they're aggressively throwing around weight with poor technique. And particularly as you're aging, I really discourage people from doing that. So the emphasis being on technique and good control of weight as you do in that, and that's absolutely protective. So building in some resistance exercises, use good technique, and then as you get to specific specific problems, there may be a few things I will tell people to be a little careful with. I'll just give you one simple example. The person who's had a little rotator cuff inflammation or has had a shoulder problem, particularly if they've had surgery, I might tell them to be a little cautious about doing overhead activities, particularly with power. But mostly we get people back to doing what they want to do. So.
Well, thank you. That's all great information.
Yeah, it is.
Well, because sometimes it can be overwhelming to be, and you're like in a gym or trying to figure out how I'm going to do something where I want results, but not necessarily end up, in your office like, oh,
Yes.
Doc, I really blew it.
Yeah, exactly.
I did. Yes.
So I want to build off of that. So, Marnie's talking about, and you're talking about, people that might end up in your office because they didn't do proper technique or didn't build the strength. People want results fast, and then they make themselves maybe a little bit vulnerable. But what about people who want to return to the field fast? How do you convince athletes that, yeah, I know you want to get out there. It's going to take 6 weeks. Don't try to push it to 3 weeks or 4 weeks or something like that. How do you convince them that they have to be patient and follow the instructions to rehabilitate an injury?
It can be a tough sell, and probably my biggest sales pitch, if you will, is actually trying to limit the amount of time they're off the field and protect themselves. And a lot of my athletes are junior athletes, and particularly in the scope of taking care of a non-professional 14, 16, 18-year-old, is explaining to them and their parents. The athlete, oftentimes, these are high-level high school athletes, people that are used to functioning at a high level, and they're very kind of singularly minded. How do I get back on the field? How do I get back out into my event that I do? And teaching them, and it's not usually that hard to sell to the parent that, listen, I want your child back on the field, particularly if they're trying to get to a college level or take things to get them to the next step. But to protect them when they're there, we need to try to do everything we can to again, to be a little repetitive, protect them and get them back to that level. And sometimes that is a little rest and to do things to build back to be ready. The hard thing comes in the Super Bowl. Gives you an idea. The playoffs or the showcase that an athlete has that they need to show off. They need to show that skill set. And to convince them that they're not able to do that is hard. If you go try to convince Saquon Barkley he can't play this weekend because he's banged up, you know what the answer is going to be to that. Unfortunately, a lot of these 16, 17, 18-year-old athletes, they're not competing in the Super Bowl this weekend, and we got to sell them on that. So that's a really tough part of the job sometimes, and it's a fine line to balance. And there is, I've been out there competing. I know what it's like, and so there are times where if it can safely do it, and there's times where I'm telling mom and dad, listen, I think, this athlete can be back out there without much risk to themselves. It's okay to play through some pain, and there's some things it is just not safe to play through. And specifically this football season where I saw a couple of little shoulder separations, and if the football player, he can't get his arm up, he can't get his arm out to protect themselves, he's at risk for a head injury or the kind of thing that could change the course of his life. And so those are the kind of things I'm telling the athletes, and still, particularly the athlete, and understandably, I have a huge appreciation for the athlete who just really wants to be back on the field. I love that motivation, but I have to look out for them, and so it's a balancing act at times. So.
Okay, before Scott, well, I have one more quick one, Scott. Sorry.
That means she's had 4 or 5 questions.
Yeah, I know, 4 or 5. I can't help it. I'm a career reporter. So
and what are we?
They are too, but I know, I'm sorry. But okay, so back in the day when my brother had a separated shoulder in football, he decided to stop playing football. And my mother, who always wanted to be a football player, but of course couldn't. She was born in 1931, and of course, there was nothing, even flag football for women. She told me that she was disappointed that he quit playing football, that if she had the chance, she would have just pushed her shoulder, popped it back in, and gotten back out there. What would you tell families that would tell their kids, just pop it back in there and go back out?
Unfortunately, I don't have, quite that situation too often where a parent is really pushing that. And if I truly think we're putting an athlete at risk, the point I would make to a family to kind of diplomatically say, you guys need to together as a family decide what the goals are for the athlete, what they hope to achieve on the field, and how important it is for them to play through some pain, 1, and 2, whether there's some risk. And so that's a kind of an important part. And then when I have athletes, and unfortunately this happens, the athlete that's had an injury that's become more chronic, and they're singularly minded, focused on that athletic achievement and what they can do. And I'm starting to look at them and see these things are putting you at risk of not being able to be a normal person, a normal student, a normal kid that's going to graduate from high school and carry a book bag on a college campus. And that's what I'm left telling them. Listen, I'm beyond thinking about you as an athlete now. I'm thinking about you as a young person and the ability to function at kind of a normal level for you to, like I said, do this a book bag, do a recreational athletic activity. Heck, now 5 and 10 years down the line, can you pick up your child if you have a child and play with your young child without pain or without a shoulder that's dislocated or has problems? And when you start bringing that into focus, most of the time the parent in the room kind of realizes the scope of what they're talking about, and suddenly it gives them the perspective of, oh gosh, I'm not worried about Johnny the baseball player. I'm worried about Johnny my son, and where he's going to get in life. And it is important. I think that it is fortunately not too often that we're talking about consequences like that, but it is. It occasionally comes up, and the shoulder separation is one thing, but probably bigger the shoulder instability and even elbow injuries. I've had a couple this academic athletic year, a wrestler who went down and ripped all of the ligaments off of his elbow in his senior year, and just said, listen, if you're not planning on wrestling past high school, you're probably retired as a wrestler. We need to do this surgery so you can just get back to being a normal person, a normal senior in high school, and then go on with life like I'm talking about, being just recreationally be able to enjoy life. And so it is tough. If you have a parent that's really pushing it, circling back to my point, is something to gently remind them as they need to, as a family, decide who's motivated, who has what motivation to be participating in that sport. And that is a tough, and it's more of a family thing than me. But I, as you can imagine, try not to get too in the middle of that, but occasionally maybe a little gentle push. So.
You've shared some incredible information with us all. I'm just kind of curious, what is it that it's your job, day in and day out? Is there a particular injury that you are just fascinated with or most rewarding to you every day?
As much as anything, to see the satisfaction of get a person to back to doing what they enjoy and what they want to do, and it varies on the phase in life that people are. It can be as extreme as the woman I just saw a few minutes ago in my clinic, who I met a week ago with a shoulder fracture dislocation, where her shoulder was out of socket, it was badly broken, and came into the hospital in terrible pain, and we did a shoulder replacement on her. And with the goals, she's in her 80s and just says, I want to be able to brush my teeth and get dressed and live through my day-to-day activities and not have pain, and to be able to hands-on address that problem and physically repair their shoulder and get her back to that over the months to come is hugely rewarding. And then all the way down to the kind of the thing we're talking about here, to see the high school athlete who has a shoulder that's dislocating from a sports injury, to repair that and see them 4, 5, 6 months later back out on the field, back doing their thing, that has its own level of enjoyment too. So there is joy for me to be found in all that, and I'm really, really fortunate to get to do a job, one that I love and really enjoy, but has these very tangible outcomes that we can physically intervene and put things back together mechanically, and then get to see the results at the end, and get to see people get back to those things in life that they enjoy. Man, is for me, I can't imagine a more rewarding job. I really get to do something that's fun and seems to really help a lot of people. I enjoy it.
Yeah, that makes all the sense in the world. Totally understand that. Marnie?
So how did you get excited? How did you decide you wanted to be an orthopedic surgeon and get into medicine?
Well, so I have a couple. I had a mom who was a nurse. I have a sister who's an internist, and as an undergraduate student, I knew I wanted to go to medical school, and got to see a sister who was further along than me, and got to see what she was doing, and thought I wanted to go do that, and then had the good fortune to in college take a job as an orderly in the operating room. So I was literally mopping up blood and transporting patients and doing the most menial task in the OR. But it absolutely changed my life. I mean, you realize as you're watching these surgeries get done, just how much more rewarding it is to me to get to be in there doing these things. And there's a little bit at the end of the day when you wind up down in the orthopedic rooms, we got the cool toys, we got the drills, we got the power saws, we get to do some pretty fun stuff,
Wow.
and there's definitely some gravitation to that for me, and in line with what I was just talking about a minute ago, getting to do these tangible things. The bone's broken, we get to put it back together and do these kind of neat things to put them back together. Torn tendons, some of the soft tissue repairs we do, get to put that together and physically see it come together in the operating room, and then get to follow those results along. It really sucked me in, and that for me, that thing that got me in there, the job in the operating room. Well, you have these moments that come along in life that just change the course of your whole life, and that's what did it for me. It just got really fortunate to have that opportunity as a young person. So,
Do you have children?
I do. I have 3.
Do you want them to follow in your footsteps?
I would not try to dissuade them, but of my 3, I don't think any of them are. I have a law student, I have an undergraduate student who's a business major, and then a middle schooler who is actually more interested in engineering, and she's in the robotics club and gets to do some neat stuff along those lines, and seems to enjoy it. So I would not have dissuaded any of my kids again, but I mean, it is a tough road, and I think it only has gotten harder in the 20 years I've been around medicine. There's people that do what I do that have frustrations with our field, but I recognized long ago that I really wasn't going to get the call up to the majors, was never going to be a pitcher for the Braves or anybody significant. So I had to better pick something that I have a skill set that I have to offer. And
Let me ask you one
unfortunately, surgery is where I had the.
Let me ask you one quick question, because we've only got about 3 minutes left. All that you shared with us. So someday, as you look back on your incredible career as a physician, how do you want to be remembered? What do you want your legacy to be?
Yeah, the thing that I really want my patients to see in me is that I was listening and treat them with some compassion. We see an overwhelming volume of people at times, and it's easy to just get bogged down and pushing through it, getting by to the next one, and seeing the next patient, and focusing on the technical aspects of what we do. I know surgeons that I would absolutely let operate on me who aren't, don't necessarily take a lot of time with their patients, and they can leave the patient a little frustrated. If everything's going well, then most of the people are happy. But if they're having a hiccup, if they're having an issue, and they don't understand what's going on, it leaves them frustrated. So I really try to give patients enough time that they have some idea of what's going on with them, what's going on with their body, and feel like they can ask me a question and feel like that I was paying attention and cared about them. And so first priority for me is to be good technically and be a good surgeon, but I want them to know that there's some compassion and truly care about making sure I can do everything to see them get better and put them in a good position to heal and do well.
Great answer. 30 seconds. Go
Well,
for it.
I just thank you so much for joining us, because I have a special place in my heart for orthopedic surgeons. I needed one when I was a child. My daughter needed one right after she was born. You guys make the world go round. You really do.
And I feel like they're happy doctors.
Yes.
Because they're making people feel better.
I think we are. Yeah.
I know, right? Because
That's
like
a
a lot
great
of
point. That's a great point.
neurologists are like a little doom and gloom, but like a good orthopedic surgeon, your life is going to be peachy.
That's a great point.
Yeah.
Yeah, great point.
And I'm sure all these athletes out here are very grateful for orthopedic surgeons. That's for sure.
I had rotator cuff surgery, and I thought it was the greatest thing in the world. It was wonderful. I got better. I knew I was going to get better. Yeah, that's a great point you bring up. Well, Doctor, thanks for all you continue to do and all the lives that you've changed for the better. We can't thank you enough for stopping by. We very much appreciate it, and continued success.
Appreciate you guys having me. Thank you.
All right. Thank you for joining us.
Thanks again. Well, that's it for this edition of yet another program here from the Super Bowl. Super Bowl 59. We're going to be back with lots more in the days ahead. But in the meantime, take care of yourself. Remember, the name of the program with Marnie and Marjorie and Scott, Journey Through Sports and Life from Super Bowl 59. Stay safe, be well, and go
Team.
team.
Go.
Right.